Lindsay is only 40. She has a serious lung infection, but also suffers from multiple chronic conditions and requires complex care. Usually, Lindsay is monitored remotely, but 9 days ago, she was rushed to hospital as a Category 1 emergency. Is this the first time you've been in hospital this winter?
This winter, obviously, 3 times last year.
Lindsay's consultant, Dr. Asad Ali, says more community support for patients like Lindsay helps to ease the pressure. But the demand feels endless. How do you cope with an aging population with complex medical problems on the resources that the NHS has?
So resources are limited and nothing denying it. And with us all living longer and living with more conditions means, yes, we do need more resources to provide care. But we also need to do an appraisal of how best we are utilizing our resources and whether we can get more value.
Since the pandemic, respiratory services have been flat out, and there's no end in sight. The last time I was here was back in December, at the height of flu season. Every bed in every bay was taken. Flu cases have peaked, but every bed in every bay is still taken. They're still at 100% capacity. The winter pressures don't simply go away. And these pressures have long-term impacts. More than 7 million people are still waiting for elective care.
Making the pocket where your pacemaker is going to go.
A list that was too long before the pandemic has only become longer.
Well done. Is the diazomals in, guys?
Professor Kiran Patel is performing surgery on an 88-year-old patient.
A little bit of pulling and pushing.
She's having a pacemaker fitted. It's routine, but life-changing operations like these that are delayed when hospitals are under severe pressure.
We mustn't miss the opportunity that a crisis affords to us. And one of the benefits is that it will force us to transform the way in which we deliver healthcare. We'll need to get better at knowing where our demand comes from, what it looks like. So we need to move from being a reactive health service to being a responsive health service, and ultimately being a predictive health service.
Lindsay hopes she can go home soon. Her needs are long-term, complicated and challenging, the same as the health service she relies on. Ashish Joshi, Sky News in Coventry.